Hello, my name is Karen Zúñiga. I study nursing in Catholic University of Guayaquil. My topic is targeting antithrombin to treat hemophilia. Definition: Hemophilia is an X-linked bleeding disorder resulting from a deficiency of coagulation factor number 8 or 9, causing hemophilia A or B respectively, and is characterized by spontaneous and traumatic bleeding into the muscle, joints, and body cavities. This is the video about
Hemophilia refers to a group of bleeding disorders in which it takes a long time for the blood to clot. Hemophilia symptoms. The main symptom of hemophilia is bleeding. Mild cases may go unnoticed until later in life, when they occur during surgery or after trauma. In more severe cases, serious bleeding may occur without any cause. Internal bleeding may occur anywhere. Bleeding into joints is common. Hemophilia treatment. Standard treatment involves replacing the missing clotting factor through a vein, intravenous infusions. Diagnosing a bleeding disorder is important so that the doctor can take extra care if you need surgery and can test or warn other family members who might be affected. Hemophilia is a common disease, yet every individual needs unique treatment and care. We encourage people with hemophilia and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about hemophilia and how to treat hemophilia, just click on the link at description or visit www.mainmd.com. Thank you.
next continue. To prevent bleeding and its complications, the missing coagulation factor is replaced several times weekly by means of an intravenous infusions, termed prophylaxis, with begins in infancy.
Clot formation involves, among others, platelets and coagulation factors. The platelets are first to arrive at the scene and begin to loosely cover the injury. Thrombin enhances the activation and aggregation of platelets. On their surfaces, the coagulation factors, also activated by thrombin, accumulate. In thrombin burst. Finally, thrombin converts fibrinogen into fibrin that then forms fibers, cross-linked through the action of factor 13. This stabilizes the developing clot. In patients suffering from hemophilia, the propagation phase of clotting is disrupted. Cannot generate thrombin in sufficient amounts to induce normal clotting. The molecule is a B-domain deleted recombinant factor 8. Its special feature? A purposely chosen polyethylene glycol polymer. This polyethylene glycol polymer, or PEG for short, is intended to prolong the circulatory half-life of the recombinant factor 8. In this way, reliable clotting could be restored.
Continue with topic. Despite advances in the manufacture of clotting factor, including recombinant and extended half-life technologies that have led to safer and simple treatment, many problems remain. As many as 50% of adults abandon prophylaxis because it is invasive and inconvenient, and 25% have development of inhibitory antibodies, which render the infused factor ineffective and lead to high morbidity. and early did the development of simple, less invasive, and less costly treatment is clearly of good. Continue. In a recent study in the Hemophilia a mouse model and in non-human primates, Schengel and colleagues used small interfering RNAs to deplete antithrombin 3 by preventing its synthesis. This led to improved hemostasis in both animals and to reduce bleeding in the mouse model. See the video.
Hemophilia is an inherited mistake in from clotting. For centuries, it was known as the royal disease. The defective gene was carried most famously by England's Queen Victoria and spread to royal families across Europe through her descendants. Now, hemophilia affects mostly males, as you can see. That's because sufferers lack a blood clotting gene carried only on the X chromosome, not the Y. This isn't a worry for female carriers like Queen Victoria because women have 2 X chromosomes, so they're able the good copy on the second. In this study, patients of hemophilia B were injected with a virus carrying a good version of the gene. The virus targeted the liver, that's the body's fat, synthesizes all sorts of vital substances. And so the new gene got to work, making a protein called factor 9 that's critical to blood clotting.
When I cut myself shaving, for example, the bleeding just stops, which wasn't happening before. And I feel better in general. This kind of a solution is something permanent.
So how significant is this? Take a look at the numbers. Injection of gene therapy costs $30,000. Current treatment using donated blood costs $300,000 a year. That comes to a lifetime cost of about $20 million.
They hypothesized that the use of this agent, herfat referred to as antithrombin 3 S8RN8, to block the synthesis of antithrombin 3, the K inhibitor to thrombin would permit hemostasis by preventing inhibition of thrombin even in the absence of factor 8.
So hemophilia needs to be treated in a lifelong basis. And the only thing that's wrong with people that have hemophilia is that they're missing something in their blood. Other than that, they're completely normal individuals. But they're missing something called factor. In the case of hemophilia B, it's factor 9. And so they need regular replacement of factor 9. Unfortunately, factor 9 needs to be given into a vein on a regular basis. And most individuals, up until now, have needed to receive a needle 2 or 3 times each and every week for their entire life. And when you imagine how difficult that would be to continue that and to never miss doses and to get these regular needles, starting when you're very, very young. So parents are having to administer these needles themselves to their children when they're 1 or 2 or 3 years of age. So it's very difficult. So there is now a big movement, a big push to develop longer-acting factory concentrates that don't need to be given 2 or 3 times a week, but instead can be given once a week or maybe once every 2 weeks or even potentially once every 3 weeks or so. So what this presentation was the results of a pediatric study on a new longer-acting factor 9 that is made by a company known as Novo Nordisk. And on this study, 25 children younger than 12 years of age were placed onto the study in which they got treated with once-a-week treatment. And what we found is that these children did incredibly well. So for a period of a year, we had a total of 25 boys on treatment, getting once a week. Prior to the study, most of these boys were receiving 2 or 3 treatments each and every week. And on this product, not only did they have
Continue. Conclusions. The potential to reduce bleeding in patients with hemophilia with or without inhibitor with a single wiggle subcutaneous dose could be life-changing. Thank you very much. Thank you for attention.